I don't know whether, you worry more about schools reopening or universities reopening, because it needs to be a focal point depending on the number of infections there, or just whether we just need to be in this for the long haul. We just should assume that COVID is here for at least the next 2 to 3 years.
Yeah, I think they're not mutually exclusive, unfortunately. We are worrying about the schools reopening, knowing that COVID-19 will be around, that the virus will be around. And, with the schools, I think everyone's goal is to get the primary schools, the K through 12 schools, back in place as quickly as possible. College kids will be able to adapt. Universities will be able to adapt. We're seeing many move online. But they also are locations, as we've seen in the past few days, that have the potential to create explosive outbreaks. Teenagers, young adults, they're going to make choices that may exacerbate outbreaks, and oftentimes it's predictable and expected behavior, and we have an obligation to reduce the risk in those spaces.
Okay, but Lauren, this is really important. We're living it in real time, and a lot of courageous people here. I don't want to be critical. We have a university where we have X number of cases, and they make a major change in policy. What is an elementary school going to do when 2 students have 2 affiliations with the virus?
Yeah, I mean, it's not fair to the elementary schools to expect that they're going to have a management plan that can deal with these sorts of situations, especially as everyone is sort of going back to their regular activities in fall. And we're going to have a lot of exposures that we may not even have the capacity to do the contact tracing, to track down the origins, to track down the transmission chains. And so, if our priority is getting kids back in school, then our priority even above that is getting community transmission under control, and that means maintaining the social distancing, maintaining these closures, maintaining all these behaviors that we've been up and down with all summer and even earlier this year.
Lauren, why can we not track and trace properly? Is it a funding problem, or is it the technology problem?
I think it's a mix of a few problems sort of coupled on top of each other. There's challenges with trust in our community around public health activities, and so that the fundamental underpinning of contact tracing is that you trust the contact tracer enough to share that important and private information with them. Also, the scale of our outbreak means you need a significant number of people doing contact tracing, and while that scale up is an option, you have to do it. You have to do the hard work that gets you to the place where you have enough people who have the know-how to do the contact tracing. And then just identifying them, it all is sort of underpinned by testing, and we still do not have a national testing strategies. There's been some pitches on some opportunities, but there's been some pooling strategies that don't work because our prevalence is so high. And so until we get a really good individualized national testing strategy that allows us to identify cases quickly, efficiently, and effectively, none of it will work as well as it should.
Lauren, who's getting it right? I don't know if it's a state or another country. Is there anyone who's doing a better job? Is there anyone that has a blueprint for this?
Yeah, I think unfortunately there's a lot of people who are doing it, or fortunately there's a lot of people who are doing, a lot of states and further a lot of countries outside of the United States that are doing a better job than we are here. I'd have to think about who exactly is doing a better job, but we're seeing in many parts of Asia that they're reopening and they're keeping cases low. In Singapore, cases are low. In a lot of countries that managed their first outbreak, their first wave better than us, they've been able to implement the strategies that we just talked about that allow them to keep the cases low, identify the people who have a case, and isolate them very quickly.